Hyaluronic acid.
More than a beauty ingredient.
When you hear the words hyaluronic acid, what comes to your mind? A facial serum, a moisturizer, or glowing skin? But that's only part of the story. What if I told you that the same molecule helping your skin stay hydrated is also helping doctors to heal wounds and regenerate damaged tissues? Chronic wounds, diabetes, and tissue regeneration.
Today, millions of patients suffer from chronic wounds that take months to heal. This article provides a review of hyaluronic acid, known for its ability to hydrate tissues and promote wound healing. It explores the HA's efficacy in skin regeneration and anti-aging, which is heavily influenced by its molecular weight. The study emphasized that combining HA with other bioactive ingredients such as botanical extracts can significantly enhance its moisturizing and therapeutic performance in modern cosmetic products. So what is exactly hyaluronic acid? Let's find out. Let's take a closer look at the first half of our repeating disaccharide unit, D-glucuronic acid.
Notice the vertical backbone of the 6 carbon atoms. At the very bottom, on carbon 6, we find a carboxyl group. This is the defining feature that transforms standard glucose into an acid, giving this molecule its name and its high polarity. But why do we call it D-glucuronic acid? In this feature projection, we'll look at the chiral carbon furthest from the top, the carbon 5. Because the hydroxyl group is positioned on the right side, it is classified in the D configuration, which is the form most commonly utilized by the human body.
Now let's examine the second half of our disaccharide unit, N-acetyl D-glucosamine.
In this Haworth projection, we see the molecule in its stable cyclic ring form. What makes this different from standard glucose is the acetyl amino group found right here at the carbon 2. Notice the orientation of the hydroxyl groups. These are critical for the formation of the hyaluronic acid chain. In a polymer, this unit will link to D-glucuronic acid via beta-1,2,4 glycosidic bond on one side and a beta-1,2,3 bond on the other.
To summarize, the 2D structure of hyaluronic acid is a long unbranched polysaccharide chain. It is built from repeating disaccharide units composed of D-glucuronic acid and also N-acetyl D-glucosamine.
Now, let's look at the unique properties of hyaluronic acid that make it so valuable in medicine and skincare. Hyaluronic acid is a naturally occurring glycosaminoglycan, which means it's a long-chain carbohydrate found in the extracellular matrix of our skin, joints, and connective tissues. One of its most remarkable physical properties is its exceptional water-binding ability. Hyaluronic acid can hold up to 1,000 times its own weight in water, making it an excellent natural moisturizer. This helps maintain tissue hydration, elasticity, and flexibility. It is also highly biocompatible and non-immunogenic, meaning it is well tolerated by the human body and rarely causes allergy reactions. In addition, it has bioelastic properties, so it behaves like both in liquid and gel. This allows it to act as a lubricant in joint while also providing cushioning and shock absorption. Another interesting property is that its biological function depends on its molecular weight. High molecular weight hyaluronic acid mainly provides hydration and forms a protective barrier, while low molecular weight hyaluronic acid can penetrate deeper into tissues and support cell repair and wound healing. These unique properties explain why hyaluronic acid is widely used in wound healing, drug delivery, cosmetic products, and tissue engineering.
This diagram shows the biosynthesis of hyaluronic acid. First, glucose is converted into two activated sugar building blocks, which are UDP glucuronic acid and UDP N-acetyl glucosamine. These two precursors are joined together by the enzyme hyaluronan synthase or HAS. The enzyme repeatedly adds these sugar units to form a long hyaluronic acid chain, which is then released into the extracellular matrix, where it functions in hydration, lubrication, and tissue repair.
Hyaluronic acid has applications in many fields beyond cosmetics due to its biocompatible, biodegradable, and highly functional properties. In the pharmaceutical and biotechnology field, it is widely used in targeted drug delivery systems, especially for cancer treatment. This is because it can bind specifically to CD44 receptors, which are highly expressed on cancer cells. This allows drugs to be delivered directly to tumor site, improving treatment efficiency while reducing side effects. In biomaterial, it plays an important role in wound healing and tissue regeneration. It is commonly used in hydrogels and wound dressing because it helps maintain a moist environment which supports cell growth and accelerates tissue repair. In agriculture, hyaluronic acid-based materials help improve soil water retention and allow controlled release of fertilizers. This reduces chemical waste and improves plant growth, especially in dry environments. In the food and health sector, it is used in nutraceutical products to support joint health and skin hydration, and it can also act as a stabilizer in functional food systems. Finally, from a sustainability perspective, it is biodegradable and can be produced through microbial fermentation. This makes it a greener alternative to synthetic polymers and support the development of eco-friendly biomedical and industrial materials. Overall, hyaluronic acid is not just a cosmetic ingredient but a versatile biomaterial with strong potential in sustainable and advanced technologies.
Hello everyone, today I will be presenting the in-health application of hyaluronic acid, also known as HA. Hyaluronic acid is a naturally occurring substance found in the human body. It is mainly present in the skin, joints, and eyes where it helps retain moisture and supports normal tissue function. It is widely used in cosmetic, medicine, and dietary supplements. Let's start with the positive health implications. Firstly, hyaluronic acid is an excellent moisturizing agent. It has the ability to bind large amount of water, helping the skin stay hydrated, smooth, and healthy. This is why it is commonly found in facial serum, creams, and lotion. Secondly, hyaluronic acid has anti-aging properties. It improves skin elasticity, reduces the appearance of fine lines and wrinkles, and gives the skin a firmer and smoother appearance. Another important benefit is wound healing. Hyaluronic acid supports tissue repair and regeneration by promoting cell migration and reduce inflammation, allowing wounds to heal more efficiently. The skincare, hyaluronic acid also has medical application. It is injected into joints and to improve inflammation and reduce pain in patients with osteoarthritis. Although hyaluronic acid is generally considered safe, there are some negative health associations. Some people may experience mild side effects such as redness, itching, skin irritation, especially if they have sensitive skin or react to other ingredients in the cosmetic population when hyaluronic acid is in aerosol or spray products. Inhaling fine particles may cause respiratory irritation and including rhinitis, wheezing, shortness of breath, or asthma. However, these effects are often related to the other ingredients in the aerosol rather than hyaluronic acid itself. The review also estimates that the effect of hyaluronic acid depends on each molecular weight. High molecular weight HA generally has anti-inflammatory and protective effects, while low molecular weight hyaluronic acid may promote inflammation in certain biological conditions. However, this does not mean that cosmetic products containing hyaluronic acid cause cancer. In conclusion, hyaluronic acid provides many health benefits, especially for skin hydration, wound healing, joint lubrication, and eye care. Although mild side effects may occur in some individuals, it is generally considered a safe and effective ingredient when used appropriately.
Moving on to the current research and innovation, this paper discusses about a few innovative platforms, which are micelles and polymersomes, inorganic nanohybrids, and also gene and immunotherapy.
This YouTube video will explain.
Scientists are using cells isolated from human tumors to develop new ways to tackle cancer.
Traditional chemotherapy often fails because it lacks selectivity, causing toxic side effects in healthy tissues. But innovation in HA-based nanomaterial offers a solution by using active targeting. Many aggressive cancer cells, like those in breast or colon cancer, overexpress a specific receptor called CD44. Because HA is the natural ligand for these receptors, we can use it as a Trojan horse.
Instead, part of the cell surface.
As shown here, the HA-coated nanoparticle binds specifically to the CD44 transmembrane receptor. This high affinity ensures the toxic drug payload is delivered only to the malignant cells through a process called receptor-mediated endocytosis. The cancer cell actually pulls the drug-loaded carrier inside its own walls. Once inside, the HA is degraded, releasing the chemotherapy directly into the cell's interior. By modifying HA into micelles or polymersomes, researchers are creating a new era of cancer treatment that is more precise, more powerful, and